Hello there. I'm pleased to have Martin Peuker from Charité with us today from Berlin. And Charité is one of the largest healthcare systems and hospitals in Europe. Martin, it's great to have you.
Hi, nice to see you.
Welcome from Berlin.
Welcome back.
And one of the things that we wanted to cover is just how you're faring with COVID and some of the changes that you've had to make given the environment that we're in and what's been going on with the pandemic.
Thanks for the question. So as you mentioned, Charité is Europe's largest university hospital. Just last year, we treated over 800,000 patients. And at the moment, we are still treating over roughly 100 COVID patients only in our intensive care units, including actually over 50 patients with complete external lung functions. So as you can see, the pandemic also demanded a lot from us on the IT side. Within days, for example, we made it possible for employees to work securely and rapidly from their home offices. And more than 30,000 employees and students treat, study, and research, the most part virtually. So we have built the new Corona intensive care units within a very short time, including completely digital network processes. So develop apps that reduce context, research projects realized within months to fight the pandemic. So we can say that the new normal has arrived, and we are proud that the IT department together with Extreme made it possible.
And Martin, this is something we've seen globally, telemedicine, remote healthcare. It sounds like you've been at the forefront of this and leading the charge. How will this change in the future when you consider coming out of COVID? What does it look like from Charité's perspective?
Yeah, look, we also saw in the pandemic as an opportunity to take things that simple work well into the future. So maybe I compose two things are very important. One thing, making data more interoperable, and on the other hand, implementing solutions that are more patient-driven. So I think what particularly impresses me is how agile we have managed to develop solutions together with partners like Extreme Networks and integrate them into our future strategy. So that brings me to our digitalization strategy. Maybe in one sentence, can describe our digitalization strategy. Anything that does not necessarily have to be done by people will be digitalized. And that means that we want to advance innovations such as AI, ML on big data with enormous speed in order to enable patient care up to basic research. We want to become out from this pandemic as a hotspot of translational research in Europe.
And this is, it's great, Martin. And we think about our partnership and where we're going. We consider data to be the new currency in the cloud world. I know you've adopted Fabric. That's a technology that is providing for automation, and you've mentioned that. So how do you see the partnership with Extreme evolving?
I can say the assurance that solutions from Extreme will have a much greater impact on making our university hospital work in the future. This includes securing operations, but also integrating innovations in Wi-Fi technology, as you mentioned, in the new Fabric capabilities, universal platforms, or also in Germany, cloud innovation. Our IT strategy is to greatly expand connectivity, as I mentioned, data interoperability and mobility, and integrate many more sensors into the treatment process in an, let me say, automated way inside and outside our hospital, and to integrate more medical devices more smartly and securely. Just one point, location analytics and asset tracking plays, for example, a major role. Offering more platform services for patients via our, let's call it, health data platform. For example, as you also mentioned, providing telemedicine, self-services, second opinion portals, and. And here it's necessary to have access to scalable solutions that allows us to provide in a high quality service. And I'm sure that we will achieve this only together with partners like Extreme to become a real smart hospital in the future.
Well, Martin, we appreciate the partnership, and we really consider it a partnership because we learn from you. And as we develop our technology, we're looking at the network as being more strategic today than ever before. And partners like Charité are helping us innovate, and we appreciate it. We appreciate you being here with us today. Thank you.
Thank you.